we had a few cases on the ward where young people after a trauma were suffering strokes. And it doesn't, that doesn't make sense on a good day for most people, but essentially when you have an injury where your neck or your head either flies forward really hard or backward with a big mechanism, you can stretch or injure your carotid artery over top of your neck bones, basically. And so, again, the system, and often, how do I put this? Like, we've got this group of people, this dedicated group of docs and administrators, and Lisa Whitman, the trauma nurse coordinator, who's fantastic, just does, has undying energy and support for the program. We meet as a group probably 4 times a year, and we go over what can we do better. And so we noticed that this trend of these young people, a couple of cases having strokes. So we looked at the literature, noticed that there's a way of screening for this injury right at the front based on a series of clinical indicators or things that you see when someone comes in. And the injury is called blunt cerebral vascular injury. And you're looking for that little tear that would collect little bits of clot and shoot them up into the brain. And so you can identify that quite early in traumas. And we've got that now to the point where we said, okay, we looked at all the cases and said, got enough to start a screening program. We put it straight into our trauma resuscitation orders, so that basically as soon as someone comes in, if they've got the mechanism, they got the right injury, they get it straight off the bat with their CT scan. And we don't have the data finished with that yet. We're going to look at how we did, but I know we've picked up numerous cases since then and had them off to proper treatment, whether it's surgery or just aspirin for a year or what have you. So we're preventing strokes in young people, which is a big deal, right? 30-year-old with a stroke, that's a lot of years to be, relatively dependent.